As a Feldenkrais practitioner, I work with my hands, and sometimes the work with my fingers is quite intense. And an example is working with a Parkinson patient. Their movement is frozen. The medication they take does something to their brain where it restricts movement, and eventually the soft tissue hardens into a solid concrete type pattern, which means the skeleton is not moving. And when the skeleton isn't moving at the joints, there's no flexibility. And so when I'm working with releasing the bones, sometimes my fingers will become sore and stiff. And it took a long time to figure out what I could do for myself after such a time, which turned into being very beneficial, because when I work with people now, many people, their soft tissue mimics that of a Parkinson's patient due to lifestyle, where they spend their time, and also the education. A lot of the education focuses on muscles. It does not focus on the partnership between muscles and bone, and it does not focus on the muscles being tonified by the movement of the bone between the joints. So imagine a focus on the muscle only strengthens the contraction in the muscle, and they become inflamed, and pretty soon the bone's not participating, versus the bone moving through gravity through joints that are being used, and the muscles are rotating and stretching and moving in a pattern that is different from simply working out and gaining strong muscles. And so our societal focus isn't broad enough. It's too focused on one pattern. And so when I work with people, I feel the results of that in their body when I touch it, and I can see it when I visually see people move. There's not a large range of motion. So some of the things that I do for myself for hand care is oil. And, I include my fingernails in that, and then I extend it up into my hands, and soaking my hands in certain oils and then rubbing the soft tissue. The inflammation goes down through the soaking with the oils. And so when I rub my hands, the inflamed tissue that comes from working hard has softened, and then I can manipulate it. And so that's what I do, is manipulate it around my fingers, in particular around my wrist, where it works hard. And there's a few muscles, I don't know if I'm far enough right here, in the wrist. People aren't aware that they can get in there with their thumb and massage these muscles. So right in here, because I've been working on the computer, this muscle is bulging and it's inflamed. If I were to continue to let it become stronger and more dominant, it would spread right across my wrist on both sides, and pretty soon I would think I had carpal tunnel. But on the other side as well, this muscle right here, it's going to hurt when you first go into this region if it's inflamed. But when you massage it and you get more movement and roll it through the skin, the pain goes away. So don't let the pain frighten you and stop you. Put a little bit of pressure on the pain, hold it for a few seconds, and see if the pain reduces. So a moment ago when I went in here, it was quite painful, but there's actually no pain here now. It's released. So that's what acupressure is. Acupressure is going to a muscle that's too contracted, and you put a bit of pressure on it and it releases. That's something you can do for yourself. So these muscles right in here, they've gone down. They're not bulging, they're not inflamed. And that comes from having my wrist bent and my fingers over a keyboard, which has been happening quite frequently these days. So right in here, That's quite painful when I do this, giving it a strong pressure as I go up and down the muscle that is inflamed. And I do this so that I can have more flexible joints. If these muscles stay contracted, my wrist joints won't be moving, my finger joints won't be moving, and it will track all the way back up to my elbow and into my shoulder joint because they're all connected. So now the pain is starting to release. So some of the oils that I've used, carrier oils, I've got coconut oil. I have an oil with a bit of rosemary in it that I use. Rosemary is good for fingernails as well as for skin. I use castor oil. And today, because I was doing my fingernails, I use frankincense and lavender, which is really good for both fingernails and skin. The lavender, I used a bit too much, so my eyes were burning slightly, but the fragrance was beautiful, and it really makes a nice condition for the skin. So I'll just show you. It really becomes nice, soft, and flexible. And with my fingers as well, they're more bendable. It's easier to bend them. This would be good for people that have arthritis or rheumatoid arthritis or finger joint pain, or if they have a lot of restriction in their fingers and their fingers are clumsy. We tend to go to the doctor for a diagnosis, but we're not aware that the tissue is so hard and the muscles are so contracted. You do have muscles that bend those joints, that it restricts the movement, and that could be where the pain is coming from. So when I work with people and I get them bending their joints, the pain goes away. So give it a try. If you do have really sore fingers or really stiff and tight fingers, soak them in some oils to begin with. Castor oil is one of the best. Coconut isn't as thick as castor oil, so that's a nice carrier oil, or rosemary oil. And then put something in like an essential oil like lavender, which is fun. So I hope this was helpful, and I will do a hand lesson. That's a movement lesson based on the Feldenkrais method, and it will focus on the joints. And it's a lovely way to bring your hands, wrists, arms, elbows out of pain. So stay tuned for that.